blessed to have so many full chairs on a Sunday morning. But what a beautiful place this is. I feel really honored to be here. I am lucky to teach this work around the country, and often find myself in a lot of rooms, let's say, that have no windows. Let's put it that way. And the working with food is so wonderful because the food, just brightens a room and enlivens an audience, and it's something we all share. It's something I'm so passionate about, and I'm hoping to share some of that with you today. But when you're out in this naturally, exquisite environment, and I feel like it reminds us so much of how interconnected we are to the land, to the water, to the people who have come before us. And that is part of this work too. This is part of the work of working with food and educating your patients on the importance of eating well. It isn't just so that they feel better or look better, or so that maybe their chronic illness is slightly improved. It's to change the way a person feels about their connection to themselves and the world around them. And to me, food is the greatest connector. I teach meditation, I teach lots of other courses around herbs and botanicals, and all of them have a common denominator of, how do I feel more myself in this physical body that I've been born with, right? And how can I best sort of serve myself and my ancestors and my planet through the food that I eat? And that's why this has to be so individualized. And today, it's wonderful to be able to work with, most of you are health professionals, yes? Can I see a show of hands of who's a physician? Okay, and other health professionals in the room too? Okay, wonderful. So you're all working so closely with people, and I know these are words you may not hear a lot about at typical CMEs where I'm talking about botanicals and ancestral health and mind-body medicine, but really food is all of that. It is not just saying these are the recipes and this is the diet that you need to follow for your optimum health. It is about how are you connected to the food that you eat, how does it make you feel, where was it grown, does that play into the way that you're feeling when you eat it, can you grow some of your own? These are all conversations that doctors and health professionals can and should be having with their patients, because all of it will tie to their elevated health and will improve your ability to help them. So it's particularly delightful to be at a Farms Food and Health Conference and not just a breakout session at another much bigger medical conference where everything is about interventions and pharmaceuticals. Because this, I feel, is the kind of place, and Groundwork is doing the kind of work that truly ties into holistic, integrative health. So you all know, probably by now, the root of Western medicine, the root of it came from food. Food was the only medicine that was used or prescribed in ancient times. So this is really a bringing back. This is a reminding of where our profession came from. It feels new, but it's not. The integrative medicine model really looks at all of the factors, right, that affect a person's life. So your mind, your self-worth, your stressors, how well you sleep at night. I spend a lot of time talking to people about their sleep, because you can exercise perfectly and you can eat fabulous, and if you don't sleep well at night, you guys all know this, you are not going to feel good, right? So we spend a lot of time talking about that. Physical activity, of course, nutrition, which we'll focus on today, but also, how much love do you have in your life? What connections do you have to your family and community? How does your spirit feel? These are other things that we can be talking about when we check in with our patients. And they may need dosage adjustments on their medications, and they may need help with their discharge planning from the hospital, but they also very much need this from us. So there's so many ways of sort of bringing our skill set and learning more skill sets so that we can bring them to our patients. And so some of the work I do is teaching patients about gratitude journaling, writing 3 things down every night that you're grateful for, about mindful movement, about a mindfulness practice, which feels like somewhat easy to do when you have a sunrise like this. It's hard to not be present in that kind of a moment, right? Certainly in my practice, we're very fortunate that we have people who perform acupuncture, we have traditional Chinese medicine, we have an herbalist working with us, and so those are wonderful people to have as part of your team. But if you don't, you can say there are people out there in the community that you can go see, you know, and remind our patients that there are other healers in the community they can lean on. So Wendell Berry, my favorite farmer, and I'm sure many of yours, beautiful writer and poet, reminds us that people are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food, right? So that's what we're changing here today. My heart belongs in this work because of this work, which is the work of culinary medicine with the medical students at University of Chicago. So about 5 years ago now, we started a program. I still call it a project because I like to call everything a project. That gives me a sense of evolution, and then, you know, it's something that's constantly worked upon. But we had this idea to start this culinary medicine class, and this is when things were just getting started at Tulane as well, and so we leaned into Tim Harlan at Tulane and licensed that curriculum. And we have Chef Shawana Kennedy working with us in the green jacket. He's a wonderful, wonderful chef in Chicago, and brought this to the University of Chicago. And I'm going to share this story with you because, you know, I think many of you may be in the same boat. We were like, we have this great idea, and we have this curriculum, and I think the students are going to love this, and there's no nutrition education in the curriculum as we see it, so of course this makes sense, right? And they were like, oh yeah, that's a great idea, Dr. Maker-Clarke. Yeah, there's no time for that. So if you can do that if you want on the side, you know, maybe on a Friday or Saturday night somewhere. And I was like, well, I need some funding, you know, to rent a teaching kitchen and supplies and a chef and some other things to run this class. And they're like, well, by all means, you could write a grant, you know. And these are the kinds of things you're going to hear. Write your own grant, figure it out. So, you know, we figured it out. We did it. We ran it. We did write a small grant. I literally asked friends in the food industry to donate some gift cards for the food, and, you know, real just Girl Scout level kind of work here, okay? And ran our first class out of a culinary school, very expensive, gorgeous culinary school that we rented time from, and opened it up to the students on Friday nights for medical students who are already, you know, working their tails off. And 15 of them signed up, and the waiting list was about 35. And they showed up every Friday night for 8 weeks to that class. And NPR heard about it and came and covered it. So then University of Chicago, you know, the ears perked up a little bit more. Wait, what are you doing over there? There still wasn't a lot of support. I won't say that there was, but they were paying attention because the students were pushing for it. They were the ones talking about it. It wasn't me anymore, it was them. And so it was through that we were able to sort of slowly and surely wind its way back to University of Chicago into the medical student curriculum, not just have it be an elective class. And now for the last 4 years, every medical student that's graduated from this very elite and somewhat conservative medical school, we have very few people going into primary care out of our medical school. All of them graduate with 4 to 5 hours of culinary medicine training in a teaching kitchen. So it feels pretty good. And this is a kitchen that we rent from a local synagogue that is actually right across from President Obama's family home. So there's some really nice vibes around there. But you know, this particular group of students they're going into orthopedic surgery, oncology, anesthesia, ER. I know where all these guys are headed. And doesn't that feel good that they all have some nutrition training? Like, I don't care what you go into, it matters no matter what you do. You don't have to be a family doctor, nurse practitioner, or someone who's on the front lines in that way. I would love for my patients who are suffering with cancer to have their oncologist talk to them about real whole food. They're craving that, they want that so much. You guys all know that. They want someone to talk to them about this instead of having to go to Dr. Google or rely on their friends. So this is the heart and soul of what culinary medicine is about. It's about, you know, training up our next generation of physicians to know that food is medicine and not have it be a sidebar. So I read this in a book ages ago, and it just stuck with me, and I've kept it in my mix for a long time as a result. Food defines who we are from the molecular to the spiritual level. We rely on adequate intake of macro and micronutrients to grow, build, repair, and fill our bodies. But through food, we express our culture, our caring, togetherness, family life, religion, faith, philosophy, and personal style. And healthy eating is a blend of all of these elements. So I bring that up to remind you that there is no one prescription for every patient. It's different for everybody. It's different for all of us. Most of my talks and time are spent giving talks on ketogenic diet and intermittent fasting and paleo and all of the questions that people come to me with. What about this? What about that? What about that? This is working for my friend. Is this going to work for me? And you have to look at that person sitting right in front of you and what is going on in their body and in their lives to determine what the best diet is for them. There is no one way that every human on this planet should eat, because we're all really different, you know, and food is really important. It expresses a lot more than just nutrition. So we all know the standard American diet, you know, isn't the greatest, and unfortunately it is still what the bulk of America is consuming, and a lot of our youth as well. There have been a lot of dietary changes in the last 100 years, and I think that's part of what our generation of physicians is really having to battle with. That, you know, when a kitchen looked like this, you know, there wasn't a big refrigerator. There really wasn't much pantry storage other than some whole bulk foods. There wasn't anything refined in this kitchen. And now all of a sudden we have a lot of processed food, a lot of packaged food. We have far more processed fats and a bunch of new molecules that the body, quite honestly, doesn't know what to do with. The body has no way to detoxify food dyes and preservatives and trans fats in high levels. So it is no wonder that chronic disease has become the norm, because our bodies have been flooded with things they never saw before, but we still have the same physiologic bodies that our great-grandparents had, right, when they were eating whole foods. It's just that we've introduced all these other molecules that our body doesn't know what to do with, and that's going to show up in different ways in the body. You guys know that the standard American diet is called the SAD diet in the literature, because it's super sad. But it's unhealthy fats, unhealthy carbs, irregular eating. You know, so I spend a lot of time with working with mindful eating with patients who do a lot of irregular eating, so that there's less eating behind a desk, in the car, on the go, standing up. Bigger portion size, combine it with physical inactivity. This is the perfect storm for chronic disease, right? But our job isn't just to say, oh, well, these are foods that are healthier for you and sit down and eat them, but also to say, this is delicious too. This can be delicious. This can be super pleasurable. This isn't a punishment. That eating for health and eating for pleasure are not mutually exclusive things, right? Which I think a lot of people still think is the case. Like, sure, I can eat salad every day and it'll be really miserable, but I'm sure I'll look a lot better. Reduced joy is not our goal. But what do we actually tell people? That's what I know a lot of you want to know. What do we tell people when the news is constantly changing? The literature is changing for us, and then for our patients it's even harder, because there's something new popping up in the media. And this was 20 plus years ago in USA Today. Consumers today are deluged with constantly shifting health messages. Instead of educating healthcare consumers, these shifting scientific studies often serve to confuse. Does anybody feel that way about things still? 20-something years later? I mean, this is all I do, is review nutritional literature and talk about this, and I'm continuously having to go, wait a minute, but this study said that, and this study said that. What do I make of all of this? But I think we really can keep things simple, and that's what I want to focus on today, is not presenting you all of the latest and greatest scientific study, but actually bringing things back to the basics so that we can be very clear and very simple in our messaging. Recent food technology, we discussed a bit, hydrogenated fats, processed grains, additives, chemical farming methods. These are really the reasons why food is making our generation sick. Right? It's the way that we've changed food. So if we can go back to a whole food, things could be better, things can be simpler. I I have some documentaries and books that kind of chronicle this story, if that's a story you're interested in. I'm very fascinated by the way food has changed, and I think it's really informed my practice in good ways. So those are some things to think about when you have some free time. But really, when I'm helping people figure out how to eat, there's just a few simple criteria. It needs to be something that will help you maintain a healthy weight, right? So it's not, very excessive in one macronutrient or excessive in calories. It has to be enjoyable. That's high up there because it's not going to be sustainable if it's not, right? Certainly the vitamins, the minerals, the phytochemicals, the fatty acids that optimize cell function and prevent disease need to be there and have a good effect on your lipids. And then there needs to be a sense of it being anti-inflammatory, and we'll go into more detail with this. The anti-inflammatory diet is a plant-based diet. And I stray away from using the word diet a lot because I think it's more lifestyle, and diet has connotations around weight loss, as you know, and that's not really always the goal here. But a food that is going to be a medicine to you and not a poison. That's how I put it to patients. You have a choice. And certainly affordable, and that needs to be an important part of our discussion too. Not everybody is going to be able to go out to the farmer's market and buy all of their food there every week. When we look at the research, I don't feel really need to be doing any more nutritional research. I'd be criticized for saying that, but I don't think we need any more information than what we have to know how to eat and how to eat well. The science is there. It's like climate change. Science is there. I don't think we need to keep doing more studies on it. During the past 2 decades, the data on diet and cancer has increased exponentially, and it all supports the concept that a substantial proportion of cancer is potentially avoidable by nutritional means. Some of the estimates, and this is from a Walter Willett study done in 1995, okay, this is not new, that the preventable proportion in Western countries of cancer is around 30 to 40% by nutritional means, right? So if someone told you you can reduce your risk of cancer by 40% by the way that you eat, isn't that something we should all be talking about every day, all the time, right? How many of us have patients with hypertension? I mean, I feel like the vast majority of my patients have that at least as a comorbidity, if not being the first thing that they're coming to see me with. A meta-analysis of 32 studies and 7 large clinical trials showed that a vegetarian diet lowered blood pressure by 7/5 compared to an omnivorous diet. It's about at least as much as you can expect from starting a medication. Right? And we know the DASH diet, of course, has been around for a long time, looking at lower sodium. But this is saying, if you start shifting to a plant-based diet, you may never need any medication. You may not have hypertension. These are the first conversations we need to be having, the very first. So I'm going to do a crash mini course on nutrition. Is that okay with you guys? I feel like a lot of us didn't get much nutrition education. We've had to sort of learn on the go, or we got it kind of couched in biochemistry classes. So I'll do a quick mini course on the macronutrients, just so we're all sort of on the same page moving forward. So protein, what's the story here? I usually talk about healthy protein sources as being whole soy, legumes, nuts, and fish. So plant-based, pescatarian, leaving that in there. Of course, with fish, there are some issues around sustainable harvesting, environmental toxins, particularly mercury. So I always give patients a mercury levels in fish handout that comes from the environmental working group, or send them to that website in their after-visit summary so that they can do some research on that as well. But you'll notice what's missing in my healthful protein sources. Sorry?
Calories.
Calories, okay.
Meat.
Meat. So I generally don't talk about meat first. I don't suggest every patient I have has to be vegetarian or vegan, but I don't put a lot of stress on meat being the only way to get protein. That was an industry-led initiative around having people eat more protein in the United States. We eat way more protein in this country than in most other countries, and more than we need. So I generally don't push meat, but if someone eats meat, we have a conversation about it. You had a question?
What kind of counseling do you do about low-fat dairy?
It's a great question. He asked about low-fat dairy. So dairy is another one that has not been shown to have any health benefit. Okay, that was another industry-driven initiative to get people consuming more dairy in the United States. And I'll cover a little bit about that. But if you are a consumer of dairy, then I do suggest whole-fat dairy versus low-fat, depending on lipid status and weight. Okay, so again, I don't have like a categorical on that. If you're someone who is of normal weight and consumes a minimal amount of dairy, I'd prefer that was whole-fat dairy so that they don't have the solvent remnants that come from the extraction process. Because again, there's nobody skimming off the fat like in the old days, right? They're using a chemical extraction process to decrease the fat in milk. Individualized instruction around that though. Why do I not focus much on animal protein? Again, because much of it is a result of modern farming methods, which consist of using hormones, antibiotics in confined spaces and feeding animals grain. Of course, this is not the only way, but it is oftentimes, for my patient population, very challenging to find grass-fed organic meat or afford that. So this is a discussion I have because I'd rather have them not eat meat if it's not going to be good quality meat. Higher consumptions of animal protein are associated with vascular disease and several types of cancer. We've known this for many decades now. And if they are going to make that choice, then range-fed organic meats and dairy are always better choices. And I have a feeling up here you might have some more access to that than in other parts of the country. I get asked a lot about paleo. What about paleo? As you know, this is a diet that really promotes eating more animal protein. I had the opportunity to speak with Dr. Boyd Eaton, who's sort of considered the founding father of our modern understanding of the Paleolithic diet, and even he is advocating that the protein consumption in paleo be predominantly plant-based now. So if every person on this planet was eating organic and grass-fed meat, it wouldn't be sustainable still for our planet. We have to think about that as well. We are connected to this entire ecosystem around us, and if all of us continue eating meat at the levels that we are, that's an incredible stress on the land and our water supplies. So how much protein do we consume? There's not a lot of hard science around this, okay? But deficiency is not a big concern for our culture, even in vegetarian diets. 10 to 20% of calories, 8 grams of protein per 20 pounds. Those are things that have been sort of put out in the nutritional literature. But we notice in things like the Nurses' Health Study that higher protein diets actually increased risk fractures in women. Okay, there are higher fracture rates that we see in people who eat high levels of protein. Red meat consumption and mortality, important. This was a pretty recent study that showed 9 articles with 17 cohorts eligible for this meta-analysis. So they looked at over 150,000 deaths, and a higher consumption of total red meat and processed meat was associated with an increased risk of total mortality and cardiovascular and cancer mortality. So know this, remember it, think about it when you're counseling your patients, especially those who do rely heavily on animal protein for their calories and their protein. There are many other options available to them. And certainly we know that the red meat and colon cancer studies, those who ate the most red meat in some of these larger European studies were about 1/3 more likely to develop colon cancer than those who ate the least. And colon cancer doesn't seem to be going anywhere. Okay. Protein and type 2 diabetes. In this particular study, total protein intake was positively associated with a risk of type 2 diabetes, largely due to the intake of animal protein, but vegetable protein intake was inversely associated with risk. Okay, these are the diseases of our time, right? Cancer, diabetes, these are the chronic inflammatory diseases of our time. There are ways that we can modify people's risk and even help reverse their disease by changing where they get their protein sources from, okay? Skip that. So the take-home message is really that eating more protein from fish and vegetable sources and less from red meat and dairy, or even eliminating it, might be best. And beans, soy, legumes, nuts, nut butters, whole grains are all possibilities. So it is our job to sort of bring those things up, elevated into the conversation when our patients come to see us, and remind them. Often I find that I have to remind my patients about things like legumes and beans as protein sources. And oh, I like that. I forgot that I like that. I should make that more. I hear that a lot. So if they're hearing it from me, it is very different from reading it online, seeing it on the news, finding out from their mom or whomever, right? When it comes from their doctor, their health professional, there's a different weight. It is coming across as a prescription. This is really vital. And I write this stuff down like a prescription. All right, so any other questions about protein, anything?
Dr. King, discussion of red meat, you referenced the 150,000. Was the red meat CAFO cows, or was it grass-fed beef?
It was not grass-fed. That is a good question. So
that makes all the difference. I'm not suggesting that we should eat a lot of red meat. It's just that what we've done to our meat industry is disastrous.
That's right.
So those studies focus on that kind of consumption.
That is true. Yeah, and I think that is that I know that is the majority of the meat that is still being consumed in the country. So, but it is interesting to see what would the rates be like if everyone was eating more healthfully produced meat. I'm sure they'd be different. That being said, in moderation, lower amounts still will always be a healthier lifestyle. So carbohydrates, providing most of the calories and most of the way we eat, certainly one of our body's preferred fuel sources, exerts a very great effect on glucose control, very demonized, right? Very demonized. And there's a lot of diets out there that specialize in saying no carbs and low carbs. Do we need to be doing this? You guys know about the glycemic index. This is a much better way to talk about carbs. When people come to me and are asking me questions about carbohydrates, or what do you think of this low carb diet, or what if I don't eat carbs for a couple of weeks, do you think that would be a healthy thing for me? I switch the conversation very quickly to starting to talk about glycemic index. I want to get that into people's minds, that there's a different way of thinking about food and how it's working within your body. Okay, and a simple visual like this is very helpful to help people understand what is happening when they're having a high glycemic index, carb versus low. So I'll often say, let's say you decide to have your, plain bagel from Starbucks at 7 in the morning, and your insulin level shoots up and your blood glucose level shoots up, and you're feeling pretty good about a half an hour later. You're focused, concentration's good, you're getting into work. And right around there is when your insulin starts to plummet and your blood glucose starts to plummet. It starts to go down real fast. And at about 8:30 or 9, you're probably yawning a little bit, maybe a little tired, starting to get super, super hungry. And that's usually when people reach for maybe a second cup of coffee. And people's heads start nodding, they're like, oh, this story sounds real familiar. Especially when I speak at schools and talk to school teachers, I just see these lights going off, because what does their classroom look like, at 9 and 10 o'clock in the morning? It looks like kids who are here, right? So, and then those are the kids who are getting sent to me with, this kid's attention is awful, he never sits still, and he's not paying attention. What did he eat for breakfast? Maybe we need to be having that conversation before we talk about any diagnostics around attention. So what if that meal ended up being, instead of a bagel, it ended up being, steel-cut oatmeal, or some of the lovely food that was offered this morning for breakfast, that is going to also get that blood glucose up, but at a lower level, and the insulin slope will be slower, and it'll be a slower slope on the way down, and you won't have that crash. And the whole day doesn't just become like that. And you start to see people really understand, oh yeah, actually, most of my day is like this. And that really affects mood and energy and sleep and health. So Walter Willett reminded us that half of the carbs in the North American diet come from places like bread and soft drinks and cakes and cookies and donuts and little banana breads that, what all of our coffee shops are kind of populated with, right? And what we've come to think is a normal American breakfast. That's not what carbs need to look like when they come into the body, right? And so a simple glycemic index chart, this I pulled off of Google Images, will help, this is pointer, so will help us teach our patients how they can make some simple changes. So, I have a bunch of patients who eat white rice, and you'll see that the glycemic index of white rice is 70. here, and if I can get them to just start eating brown rice, the glycemic index goes down to 50. And as they get used to the chewiness of that, and as they get used to that textural change, maybe we'll move down to wild rice, which I was taught last night is growing wild here in northern Michigan. It's pretty cool. Wild rice has a glycemic index of 35. Now, as you guys know, there's a big difference between the way white and wild rice tastes. That's a big shift to ask of someone who's been eating white rice most of their life. But I'm not saying stop eating rice, right? There's at least that. Like, let's try to work with what you have so that your energy levels can stay more stable throughout the course of a day. And working with patients to realize that fiber content will decrease the glycemic index, and the amount of processing certainly will. So a steel cut oat versus their quick oats, big difference, right? It's going to take much longer to digest. And the fat content. So that's why, like, you know, America blew up in our obesity rates during that period of time where everything was fat-free in the 80s. Right? You need fat to slow down the gastric emptying. You need fat to help slow down the increase in blood sugar in the bloodstream. And without it, you know, the calories are going to go straight into the blood glucose is going to shoot up, and the weight will as well. So don't get rid of fat if you're looking to lose fat. Lemon and vinegar lower GI. Glycemic index, you know, so there's ways to spice things. I was lucky to spend some time in Italy this summer with my family, and we were all shocked at how al dente the pasta is in Italy. You know, it almost tasted undercooked to us because we were so used to really kind of mushier pasta and the way it's served here. But if you make your pasta more al dente, it's going to have a lower glycemic index. There's less processing that's happened to it, right? More work for your body to do. And certainly lower glycemic index diets are linked to better weight control and diabetes prevention and lower heart attack rates and earlier satiety and so many good things. So that's a way to shift that conversation from carbs to how is this food working in your body and how can you think about it differently instead of saying, well, carbs just stink and you should just decrease them altogether. Okay. This was an interesting study I threw in because it was like they had two groups that were fed two meals that had the same amount of calories, but they just differed only in glycemic index, and then they let people just eat whatever they wanted for 5 hours after the meals. And there was an 81% greater intake of calories in the people who had like the high glycemic index group. So that's part of where some of the weight issues can come in too. If you're eating a lot of high GI foods, you're going to eat more throughout the day because you'll keep getting hungry. So to avoid that sort of, you know, up and down, you can help people reset their eating habits by just educating them on this and then seeing them often. Okay, any questions about that? Yes?
My daughter's a grade school teacher, and I go in and talk about food. And what she and I have discussed is the children who have all of these behavior issues and whatever.
Yeah.
The whole family would just go to bed earlier and have more time to get up in the morning and wake up and eat something healthy. It would make all the difference in the world. She talks to parents all the time, just go to bed earlier.
Yeah.
Have more energy the next day to do the right thing. They want to do the right thing. But
I'm so glad you're talking, or she's talking about that with families.
Yeah.
Sleep and food, sleep and food.
Go to bed.
Yeah. I know, how can we expect our youth to sit behind a desk all day on very little sleep, lots of screen time, and high glycemic index diets? We're asking too much of them, and then they're being over-medicated. And that's a talk for another day, but I'll be happy to come back and do that one because I have a lot to say about mindfulness in schools and the difference that can make. And providing a good breakfast for all of our country's kids. So fats. Fats are another one that, I feel like we need to remind people fats aren't bad. It's another word that was kind of taken from us and demonized. We know again that when fat was kind of taken out of foods in the 80s and 90s, obesity rates went up. The Mediterranean diet you're all familiar with, loads of study and super delicious, but it's high in the right fats. It's got plenty of fat in it, it's just the right fats. Ansel Keys, famous cardiologist, 7-country study from the 1950s, was talking about how total fat in the diet and heart disease were not correlated, and people thought he was pretty nuts back then, but that's come around in very many interesting ways. In Crete, with the highest fat intake of his study, 40% of calories had the lowest coronary artery disease rates because their fat was coming from mostly omega-3s, right? Still is in Greece and in the Mediterranean. So, again, it's changing the conversation. When people are talking about fat, I just simplify things, teach them about what a trans fat is and how that's what you need to avoid. The deep fried foods, the trans fat that comes from processed food, because it doesn't really exist in nature. Trans fat is a human created molecule that came so that we could keep products shelf stable, right? If you bake a muffin at home, you can't leave it on the counter for 3 years. But if you put it in a cellophane wrapper and sell it in a coffee shop or a hospital cafeteria, it probably will be sitting there for 3 years and taste exactly the same. That's trans fat. And it's associated with insulin resistance. Hydrogenated fats are pretty awful, and I quote Walter Willett a lot because he's been at Harvard for a long time, talking about nutrition for decades, and he just kind of simplifies messages in a way that I really appreciate, but he tells it like it is. Hydrogenated oils represent a huge disaster. They're one of the worst things ever to happen in our food supply. Yeah, I think he's right about that. So this is one of what I call, when I talk to kids, a red light food. And, I use that imagery with patients, adult patients as well. There's red light, yellow light, and green light foods, and hydrogenated are some of the red light. Just say no to that. Just get that out of your life. It's never going to do anything helpful. And there are some cities, like New York City, which some years ago actually banned trans fats from all of their restaurants, and there are more cities that have adopted that. So that's a great public health initiative that I'd love to see more of the country adopt. So what do we adopt, or what do we want to emphasize? Monounsaturates, the MUFAs, they decrease the low density lipoproteins, they decrease blood pressure. There's antioxidant flavonoids in olive oil on top of it, so you get some other really wonderful health benefits from olive oil. And omega-6s you don't hear as much about. They are essential, they are needed, but they are just consumed in great excess, and that's why we don't often talk about them as much as the omega-3s. The omega-3s, on the other hand, if you remember back to when and forgive me, you guys probably know a lot of this, but I love to go back to refresh our memories from the days when we used to draw out cells and cell biology. Remember, those were fun learning times, but we would draw those big fats into the cell membrane that would cross the cell membrane junctions, and those were the omega-3s. That's what those were. They didn't ever talk to us about the foods those came from. That would have been helpful when we were learning about it, but that's, we don't make them. They have to be eaten. So omega-3s help modulate inflammation. They're great for brain function. They are helpful for arrhythmia protection. There's so many trials that have shown that supplementation of omega-3s actually can decrease non-steroidal anti-inflammatory use in inflammatory diseases like rheumatoid arthritis. And the healthiest diets in the world are rich in omega-3. So there's not too many patients who are leaving my office who don't have a prescription, usually entirely food, for omega-3, and sometimes for supplementation, because I do see people who have autoimmune diseases who need higher doses than what they're able to consume through food on a daily basis. So the plant sources of omega-3s, which I'm going to demo for you in just a little bit here, provide the alpha-linolenic acid, the ALA. So those are seeds like flax and chia and pumpkin seeds and hemp and walnuts and purslane. Who's had purslane before? Oh, that's so great. I'm sure it grows pretty wild out here. If you just forage around in these forests, you'll probably find it. In Chicago, it's known as a weed that grows through the cracks of the sidewalk. It has red stems and it kind of spiders out, and people are always pulling it out and throwing it away. And I'm always like, that's food. That is omega-3s. Maybe you shouldn't be eating it off of the sidewalk in Chicago per se, but that's a delicious food. And a purslane salad is a very high omega-3 meal. But ALA does need to be converted to DHA and EPA in the body. And DHA and EPA exist in their whole form through fish because they consume algae. So that's where the fish piece sort of comes into what I consider an anti-inflammatory diet. Not everybody converts ALA to DHA and EPA at high rates either. That's a enzymatic genetic individualism that I don't check in people typically. So the animal sources are usually these these cold water fish. Again, very important that we try to eat wild fish, not farmed fish, and also smaller ones that concentrate less toxin. I had a kid in my office very recently who had extremely high mercury levels, and when I was kind of shocked because his twin brother didn't. And he was exhibiting some behavioral changes, which is why we checked it in the first place. And when I did a dietary intake with Mom, that one twin was getting tuna fish sandwiches every day for his lunch in preschool. So,
I'm glad you mentioned that conversion issue of the ability to whatever it's. So then, thinking about these seafood, cold water fish sources of EPA and DHA, and your comments earlier about harvesting practices and fishing and all that
yes.
stuff. Are you aware of any research on the quality of fats in non-ocean fish, whether it's like inland lake fish or river fish, anything like that, as it relates to these kinds of fats that might be more regionally accessible and not be
Coming in from other places.
From oceans or
It's a good question. I mean, I haven't seen any research, which doesn't mean it doesn't exist, around, aquaponics and sort of how that movement is potentially changing our nutritional accessibility, because you're right, like in the Midwest, a lot of the fish is getting flown, it's coming from here or from much further away. But we do have a lot of local fish industry coming up through hydroponics and aquaponics, but I haven't seen any nutritional research around it. That would be really interesting and important. It may be something we should try to collaborate with some of our small fish farmers around.
Do you have a comment on what type of fish oil supplement you recommend if the person says, don't like fish, I won't eat fish?
Yeah.
Or request fish again?
I have a couple, I can speak with you afterwards about a couple of brands that I like, but I'm real flexible with people around there, because fish oil also is, sometimes it's really hard for people to get down, or they feel nauseated, or they get these sort of like fishy burps afterwards, which are really unpleasant. I usually do recommend people keep it in the freezer. That really prevents the aftertaste that can sometimes happen a couple hours later. I use the lemon flavored liquids for kids, but I can give you some other recommendations.
You usually do the whole liquid, not a pill form? Or?
I do both, depending on the patient. Some people can't, because the pills are a little bit bigger, they can't always swallow them, depending on their particular issues. This is a really boring medical school looking slide that I only bring in to remind you, we did probably learn this at one point, but mostly to remind us that the omega-6s were ultimately broken down into arachidonic acid and the omega-3s to DHA and EPA. And you remember arachidonic acid, right? That was one that's sort of stuck in our head, because that was the head of the complement cascade. It's the top of the inflammatory mediator cascade. So if you're consuming a lot of food that is ultimately going to be broken down to arachidonic acid, you're giving your body all of the building blocks of inflammatory mediators, versus the same enzymes are being used to break down the omega-6s as the omega-3s. If you shift the formula in this direction by consuming more omega-3s, those enzymes are going to be used on this side and not on that side. It's kind of a simple message in that way, and sometimes I'll use I'll explain it to people whose brains work better that way. If you put more of this in, your body's going to work more on the anti-inflammatory side of things rather than creating more pro-inflammatory mediators. And especially in my patients who have Hashimoto's or who have rheumatoid or who are suffering from several chronic inflammatory conditions, this really matters. They already have a predisposition towards creating inflammatory mediators and having interleukins and cytokines circulating, and they don't need to be eating food that's going to push that, drive that chain further. Okay? So desired ratio is more like 4 to 1. I think what most Americans end up eating is something around 16 to 1. All right, I'm going to move through a little quickly because I want to get to the food. Can I get a time check, Paula? Okay. So foods that contain good omega-3s, fish, avocados, walnuts, omega-3 enriched eggs are a possibility for patients who, I have a lot of patients who are like, I don't like any of those things, but I'll eat eggs. Okay, at least eat the omega-3 enriched eggs. But that's part of our job, is just sort of saying, okay, well, you don't like those things, maybe I can present a recipe to you that will offer it in a way that you're not familiar with. And that's sort of some of what we'll do today here too. And then the 6s and 9s are coming from this stuff that gets overconsumed anyway. So refined sugar is a topic in and of itself. I think we all know that this is part of the problem. This is part of our current sort of health crisis problem, is that there's just a great overconsumption of refined sugar. Part of it for me is just teaching patients and parents specifically how to read a label so they know where sugar is in the food that they're eating, in the processed food that they're eating, because it's going to show up in places like grape juice concentrate, or fruit juice concentrate, or brown rice syrup, or under maltose, or places where they may not recognize it, right? So putting together all of this, our protein, fat, carb, mini course information, there are some places in the world that really seem to do this really well, and I think we can learn from them. So the OKINAWA diet, this is considered one of the blue zones. They have one of the highest per capita centenarian rates in the world, and these are not centenarians who are in assisted living. These are centenarians who are out living their lives, like chopping down grasses in their yard, and living vibrant, healthy lives. So that's where a lot of attention has been directed to these blue zones, to say, what are these cultures doing differently? It's not just food, but food's a big part of it. They eat a very high, diverse assortment of fruits and veggies, fish, soy, whole grain, and very low meat, sweet, dairy, and processed food intake in these areas, okay? Their food tends to be flavored with herbs versus salt or fat or other additives and heavy sauces. The main fluids are green tea and water. The portion sizes are very modest, and the eating traditions are embedded in a very rich, health-promoting culture where they're sitting down to eat and they're sitting down with other people to eat, right? So it's more than just what we eat, it's how we eat it and who we eat it with and the state of mind we're in that we're eating. And there are some cultures who I think have done a wonderful job of preserving those traditions. And that's something, again, that I think we can bring into the conversation when we talk about food. The Mediterranean diet, we all know, is very high in fruits and veggies, whole grains, legumes, nuts and seeds, high in fish, again, low in meat and dairy. We see a lot of the same sort of qualities, even if the foods are different and the foodways are different across the world in places where we have blue zones. Olive oil is the principal fat, but they drink red wine with dinner. There is some dairy, but it's moderately used. And that all came out of the Chakopoulos study in 2003, which is on the boards, by the way, and I remind all of my medical students of that there are some questions about diet and nutrition, and they should know about the studies around Mediterranean diet. This was a really interesting one that was just done in 2014, but 12 weeks of a Mediterranean diet actually significantly showed more pronounced increase in flow-mediated dilatation of the vasculature. There was a decrease in the high-sensitive CRP, interleukin-6, and intracellular adhesion molecules. So on the molecular level, you see less inflammation and more dilatation with a Mediterranean diet in just 3 months. So that was very impressive to me. And again, another way of helping people say, this is something you can do for 3 months. I know that you can do it. I will help you, and I will follow up with you, and we should be able to see some really pronounced outcome-related results, after that period of time. When I talk to kids about this, and even our medical students, I think it's important to remember why fruits and vegetables are healthy. I think we know that, but it's important to remember why. And they are just this perfectly packaged foods, and they're rich in fiber, they're very nutrient dense. There's a ton of protective phytochemicals, which is usually the colored part of them, and that's why that rainbow variety of fruits and vegetables is so helpful. You're getting hundreds of phytochemicals, some identified, some unidentified. And it's protective against so many different kinds of chronic disease. They're low in calories, they're lovely to look at, they're lovely to eat. They're very low in the food chain, so there's less accumulation of biotoxins as opposed to animals, right, that are eating all kinds of things along the way. And there's just so many health-promoting chemicals within them, that some of which we understand and some of which we don't. And so I feel that they really should be the backbone of a person's diet. And preferably, not wrapped in plastic, but just something that they can go pick out from a store in whatever shape and color they desire. I'm very non-specific and not a big believer in these are the superfoods, just concentrate on these superfoods. Whole food is superfood. Just sort of have a variety of it. Don't just pick broccoli and cauliflower because you heard cruciferous vegetables are the anti-tumor foods and then eat those to the point that your digestive system's really suffering, because it's a lot of fiber. So have a good amount of variety. Remember, I always teach my medical students, like every color is a different, really strong phytochemical. So I'm not gonna tell you to go eat an orange pepper, just go eat something orange. Just make sure when you get to that checkout lane that your cart has lots of colors in it. But I'm not too specific about what they are. Okay? And a higher level of fruit is associated with lower blood pressure, lower blood glucose. You gotta have, your New England Journal articles when you're talking to USC medical students. You gotta back up what you're talking about. Significantly lowers risk of major cardiovascular disease. I'm going to move on to dairy because someone mentioned this earlier, and I think this is really important to mention. Lactose intolerance is very common in humans. Milk protein, I see, exacerbates inflammatory conditions in many people. It is high in saturated fat and calories. I do mention that there are other calcium sources. Again, dairy was pushed very strongly by industry as being a source of calcium, and that was an industry-driven initiative. That was not a science-driven initiative, okay? Calcium comes from lots of different places in the diet. Dark green leafy vegetables, broccoli. You can get fortified soy milk and fortified orange juice if those are ways in which people want to get their calcium from a drink. But calcium balance is related to a lot more than just calcium, as you know. There's magnesium, there's boron, there's silica, there's a lot that our bones require to be strong, not just calcium. And population studies actually correlate that the higher per capita calcium intake that is found, that is related to higher fracture rates. It's the opposite of what we were taught. Okay, sometimes it sounds kind of harsh, I think, when I talk about this to people, but I feel that it's very important to remind people that cow's milk is breast milk for cows. We are the only species that drinks the breast milk of another species. We are not suited to digest the breast milk of another species. I had mentioned to one of my children, I'm so lucky to have one of my kids with me here today, but not this child, one of my other children who still really enjoys her cow's milk. And I'm not heavy-handed about it with my own family. I feel like they'll come to their decisions in their own time. But of course, this is their mother, so their fridge is going to look a certain way. And I said, well, what if I just put a carton of human breast milk in the fridge instead of that cow's milk? What would you think about that? And she was like, Mom, she's just disgusted. And it just was interesting to me to kind of see that reaction. It's a reaction I get from a lot of people. I'm sure a lot of you felt some level of disgust when I just said that. But it's all in the way we think about it. We're drinking cow's breast milk. That's a choice you get to make. You make a choice. If that's what you want to drink, you can. It's available. There are healthful ways of doing this. But the body has shown us time and time again that cow's milk does not agree with our digestion. It can be inflammatory. It tends to increase mucus production. And there aren't really enough solid health benefits from it for me to see a reason to promote its use. Whether I take it away from people depends on the person. Okay. So that's what I want to say about dairy. So we talked about really the building blocks of an anti-inflammatory diet, okay? And the collateral benefit of eating this way, this practice, this lifestyle, is that it's generally best for your overall health and disease prevention, okay? It's generally just a good way of living. Emphasizing fruits, veggies, omega-3s, low GI carbs, nuts and seeds, limiting meat and dairy, processed foods, additives, identifying sensitivities. Sometimes I'll do this with patients if the need is there to do some allergy testing or see if there is something specifically they're sensitive to. Trying to improve their omega-3 content over their omega-6s. Keeping it really simple that way, okay? So this is a pictorial that came from one of my teachers, Dr. Andrew Weil, and I still think it's one of the best ways of thinking about what an anti-inflammatory food lifestyle looks like, with the bottom of the pyramid being mostly veggies and fruits, but there's still being layers in there for other sources of protein like high quality cheese and skinless poultry and lean meats a couple times a week. And of course there's a chocolate layer on top. I mean, what else do you want from a pyramid? Of course it's a plain dark chocolate, 70% cacao or more layer. But I think it's a beautiful and supportive way of putting forth a way of living to a patient that isn't overly prescriptive, that isn't overly restrictive, but reminds us that there is a lot of variety and a lot of flavor and a lot of, deliciousness that can come from eating in a way that fits your lifestyle, but is also evidence-based and can show you some great health benefit. So, oh, this came out so small, I'm sorry. I just want to mention that I think there's just a huge mismatch between the way we live in the modern world, to your point about children not sleeping and not getting what they need to eat in the morning. But I don't think that we're really meant to live the way that we're currently living. I think that many of us are spending time sedentary, alone, staring at glowing screens that are giving us a perpetual level of information overload, eating processed food, sleep deprived from artificial light, extending our natural days well deep into the night, and sometimes the middle of the night. And I think it's undermining our physical health and our mental health in very profound ways that we are only just starting to see. My concern is for the youth right now. It's really for the youth. I think that it is tantamount that we treat this as an emergency, that this modern way of life is not going to promote the health of our survival as humans. And I see so much depression and so much anxiety in my office, not just in adults, but in kids as young as first grade. And I can't help but think that there's something about our lifestyle that's promoting this, right? So there's so much more than the discussion around food that we need to bring into this culinary medicine teaching, because food is just one small part of the way that we build a healthy life for ourselves and our families. So my prescription for patients is really revolves a lot around moving our bodies every single day. I prescribe 10 minutes of dancing to every patient. That doesn't mean you have to go take a class. It just means you can like jam up the tunes and rock out in your house for 10 minutes. We all did this at one time in our life, and if you have ever had a toddler in your life and you jam some tunes, they start dancing like right away, because it's in our blood to do that. And dance brings bliss. It truly does. It raises our levels of our which is a hormone that is actually a bliss hormone. That's what anandamide means. And it can instantly remind us, of our humanness and of our joy. I remind people to be truly as opposed to electronically social. So call somebody instead of texting them, or even talk to somebody face to face for just 5 minutes a day. There's some people that aren't doing that. Eat whole and unprocessed food every chance that you can to eat. Eat sitting down. Get outside and let the light enter your eyes just for 5 minutes. No sunglasses, no nothing, no phone. Just let the light enter your eyes 5 minutes a day. Serotonin boost will be immediate. Align your sleep more closely with the sun's cycles. When it's dark out, then you don't have to pop up the laptop and start shining more light in. It's the sun's setting and we're supposed to be setting as well. And look to your own ancient spiritual traditions, particularly those that include meditation, because those are really valuable opportunities for emotional well-being. And all of us have some connection to a spiritual tradition in our family, even if it's not currently present. Or maybe you find something new. There's a lot being taught out there. But these are all ways that we can improve our ability to live well and live a healthy life. And I think as physicians and health professionals, it is on us to be talking about these things. It is on us to be that person for our patients, and not just look at their labs and look at their numbers and try to tweak all of those, but to look at that person in front of us and say, what does this person really need? What are they really missing? So, well, thank you for your attention. And yes.
Thank you. I had so kind of a two-part thing. I wanted to ask, how do you approach with your patients, and obviously we're speaking to our client here, giving some bullet points, but how do you empower them to understand the function of food rather than just finding some new lists of things that they need to eat, in terms of what do you recommend for clinicians to be teaching about the physiology, the function, the purpose? And then the second part of it is, how do you at the University of Chicago utilize dietitians? Because much of what you're talking about is what a dietitian is trained in doing, and that is our expertise. So how do you work with that other discipline so that you as a physician can do the deeper work in your lane and allow us to do work in our lane, and then have a synergistic power?
Yes, thank you. And thank you for being here as a dietitian. So my clinical practice in Evanston is not at the University of Chicago, so I'll speak to that one. And we do have a nutritionist in our integrative medicine department. I do rely on her heavily for people who I want to take a deeper dive with. As you know, there are a lot of insurance limitations, and that's unfortunately one of the greatest barriers to not being able to collaborate with our true nutritional professionals in our system, or that one extra appointment, or that one, inability to see the nutritionist because of their insurance sometimes is too big of a chasm for them to jump. But I make that referral every time. I also rely very deeply on to your first question on handouts, because we have, this is a lot of stuff I covered. You guys know we have 15 minutes or, sometimes less with our patients. I do have longer patient visits. I'll tell you, I see new patients for 45 minutes and follow-ups for 30 minutes, which does, yes, make me one of the least productive people in my healthcare system. I'm very proud of that. No, if anyone's watching from my healthcare system, I'm not very proud of it. But I'm very proud of the care that I give my patients, because it requires time. And it just requires time to do this kind of deep dive. And I don't think it's impossible to do this work in short visits, but you need to then have handouts that are going to provide that extra information. And I do use those a lot. A lot of what I've talked about here, I will have written out, and then I can go through sort of quickly with them, but I can give them to look at, and then we revisit it on another visit. And then I also depend on our nutritionist to do some more of that work as well. So those are some of the ways in which we do collaborate. And then, I'm doing a lot of these culinary medicine trainings for any of the physicians that want to join us in the classroom with the medical students, which has been really helpful as well. Thank you. Yes.
Thank you very much. I was wondering, you mentioned NPR. And
Yeah.
so the thought came to me, would we reach more people by perhaps having more programs on PBS, or even referring people to know more about blue zones and things like that?
Yes, we would. Absolutely. I think media is going to be the best and fastest way to get this information out there. And a lot of, not so much me, but a lot of my colleagues have gone that route of PBS specials. My colleague, Dr. Mark Hyman, has a special, and there's podcasts abounding around, which is wonderful. But I do believe that would be really, really meaningful to have media partners around this work. My work has always been sort of one student at a time, and I very much value being able to interact with people in that way. But I think, opportunities like this I always welcome, because, now all of you will go out and spread to another 100 people and that's how we move this forward. If you have any connections to that, it would be a wonderful idea.
You mentioned identifying sensitivities with different foods.
Yes.
Do you use the elimination diet, and then because it's really hard for patients to actually do the elimination diet and then add in, certain foods slowly, or do you specifically utilize some labs
Testing.
to do the?
Yeah, that's a great question. I very rarely use food allergy testing. I have not found it to be helpful in my practice. there's been maybe a handful of patients for which it's been illuminating to find out something they were eating a lot of that came up very high on their IgE testing. But the elimination diet really still is the gold standard. And I don't pick out, let's take out onions and let's take out garlic, and we'll just do some of the big, I kind of go through that with them and see what are the things they eat the most of, and we'll eliminate some of those. And oftentimes we get a lot of information just from doing that. And again, of course, gluten and dairy are the big ones. A lot of people feel so much better without those in their diet. Mostly, again, I was talking to somebody about this last night, not because we're not, there's something particularly wrong with the gluten molecule, but it's the way that it's presented in the bread most people eat with dough conditioners, not with fermented breads, that is the problem. So when we even get them on different kinds of bread, that can be more helpful to them. I'm gonna move on to food, yeah? Okay, so I'm gonna put my apron on. We're gonna get making something here. So you guys, I wasn't at the rest of the conference, but I'm assuming that you saw some really beautiful food being made with all kinds of beautiful ingredients and maybe some really exotic and interesting ingredients, and that's not what we're gonna do today. Because what I do when I work with patients and with students is really keep things very simple and very economical, and I wanna remind you that that's always a good way to go. You don't have to have really unusual and hard to find ingredients to eat well. And one of the first recipes that I learned from a friend of mine who's a integrative nutritionist was to make a chia pudding. Has anyone had chia pudding besides just this morning? Okay, so it's so incredibly easy to make, but I wanted to bring it up. I wanted to talk about it today in particular because I spent so much time talking about omega-3s. Chia seeds are amazing, okay? They're like these beautiful, beautiful little seeds. And I'm going to pass this around because maybe you haven't really experienced chia seeds. I'm guessing a lot of you have. They're really small. They're much smaller than a flax seed, and they have a much softer shell. So as opposed to a flax seed, which is typically a lot better to eat ground because we can't break down the outer shell of a flax seed, and so it just gets excreted whole. A chia seed has a hydrophilic outer shell, and so it absorbs a lot of water and it breaks down much more easily, and it's a great source of omega-3s. It comes from the salvia plant, which is a member of the mint family, and I love learning. Another thing I'd encourage you to do is really to learn about food. Like what plant does it grow from? Could I grow this plant? Could I plant these chia seeds and grow chia? Did anyone here grow up in the 80s and grow some chia? Chia. Does that sound familiar? That was a very odd way for us all to be introduced to chia. But, I had my porcupine chia pet. So I was an early sprouter, right? That makes us all early sprouters. But chia is a member of the salvia family, which is one of the mint family members. And because of its hydrophilic nature, like I was just speaking about, it absorbs a ton of liquid. And the Mayans really treated it as the sacred food because the Mayans were long distance runners. Many of them were very, like ultra marathoners in our modern time definitions. And so they would eat chia seeds as a way of staying hydrated. Because the chia seeds would absorb so much liquid, it was a way of keeping yourself hydrated over long periods of exercise. And even now, many runners who are in the know do eat chia for this reason. Now, I would remind you though, you need to really activate that hydrophilic nature, it needs to be soaked. Okay, so what we had pre-made for you today are these chia puddings, and you got to have some for breakfast as well. And you see, this was just a tablespoon of chia. Look how big this chia pudding came to be overnight because it absorbed all of the almond milk. This was a non-dairy alternative. We chose here almond milk. You can use water. You can use dilute fruit juice. You can use coconut milk. That's my personal favorite. You can really use any liquid of your choosing to create a chia gel, as it's called. And it will absorb up to 12 times its own weight in liquid. So it needs to be soaked before you eat it. It doesn't have to be for a long period of time, though if you do it overnight, it's really nice because it's cold, refrigerated, it's gotten nice and full. But I would really make sure you don't eat it dry because of that hydrophilic nature. If you're just chewing on chia seeds, it will immediately start to absorb water from your mucosa, from your esophageal tissues. And there have been actually a couple of case studies of people who've had a blockage from chewing dry chia seeds. So especially if you have dysphagic patients or if you have people with slower emptying times or gastroparesis, absolutely. If you're talking chia with them, make sure they know it needs to be pre-soaked. But it's a really wonderful way of bringing a bunch of omega-3s into the diet. It's a lovely, lovely breakfast. I usually just eat it like this, and sometimes I'll put a little spoon of local honey or maybe a tiny bit of maple syrup in it. But if you're using an almond milk or another dairy alternative that has a little bit of natural sweetness in it, you usually don't need to add anything else. And then, even better, just put a little bit of fruit on top of it, and bingo, here's breakfast. You can make several jars of this and just, have an entire side row in your refrigerator of chia puddings, and that's your breakfast. You can take it with you and then slowly and mindfully eat it while you're sitting someplace at work or do it at home. But I bring this one up because it is such an economical breakfast. It is very simple. Okay, it's not very fancy. A bag of chia seeds will last 3 to 4 years if it is, properly closed. And they're usually about $5 to $6 a bag. And if this is just a tablespoon giving you an entire breakfast, that bag will last you a really long time. Okay, so that's how simple it gets. And you have that recipe in your workbook. And sometimes I'll put the fruit in there overnight, but a lot of times I'll just add it in the morning, whatever's around. I want to take a mention of honey because we had a really nice conversation last night at dinner. I was talking with some of the other speakers around local honey, and I think you all probably have some really wonderful local. Do you have some up here? Oh yeah. So Michigan honey is so coveted in Chicago at the farmers market. So the interesting thing about, honey is just a topic in and of itself. It's such a beautiful medicine. It's been used as a medicine for thousands of years, for wound healing, for anti-inflammatory, its anti-inflammatory action, and also for allergies. Has anyone heard about using honey for allergies? So, the science hasn't borne this out, to be honest. We haven't seen a lot of research that has shown this to be true. But local honey certainly is a form of immunotherapy, right? It can be a form of immunotherapy in the sense that the bees are pollinating all of the local flowers, and some of that is going to enter into the honey supply. And what is an allergy shot? It's giving a small amount of an allergen to a person slowly over time to help them build up a lower immunologic reaction to that allergen. So, honey can do that exact same thing. And for a lot of the children in my practice who have allergies, before they do allergy shots, I'll have them try local honey. Just a tablespoon, couple tablespoons a day, and see how they do with it. And for some kids, that's been really helpful and really effective, and adults too. So think about honey as a medicine. This was something my mom always put on any abrasions that we had. And she would mix it usually with some turmeric as well, which we'll use in our eggs and make a paste. And this is very often used in India. But now we have studies around the use of turmeric and honey for diabetic ulcers and wounds. And it's very effective. And there's some actual prescription salves that have been created that are honey-based. So that's a sweetener that I would prefer over, of course, any refined sugar. Any questions about chia pudding? Okay. I kept this as simple as possible because really, it's fun to get fancy, but it's also fun to stay really simple. All right, let's see if we can get this going here. I use a lot of these hot plates. I didn't mention that I also teach in the Chicago Public Schools with my students. And that's another really rewarding part of this work, is that once the students are, introduced to culinary medicine, they're so activated, and first of all, they just love being able, you can imagine, to come into a teaching kitchen after they've been like sitting all day, trying to take in all of the pathophys that they're learning. I usually have M1s and M2s that I'm teaching. And once they're trained up in culinary medicine, after they've done a few classes with us, I take them out with me to teach a class I call Food is Power in a neighborhood called Englewood on the south side of Chicago. And this neighborhood is a food desert, and in the Chicago Public School that we're in, we have quite a few kids who don't have ready access to food, period. They're just not getting the calories that they need in a day. And I would say that the school breakfast and lunch is really lacking nutritionally, and I'll leave it at that. So the students and I come in and teach this class called Food is Power, and we shifted it from food is medicine because, interestingly, when I ask those kids, and every year I get a new group of kids and I say, what are the words you think of? When I say the word medicine, what do you think of? And I get pills, shots, diabetes. They're just calling out the words they think of when they hear that word medicine. And my goal is that that word medicine starts to mean something else, right? That medicine starts to mean food, and it starts to mean plants, it starts to mean dance, and it starts to mean connection, and something else besides a pill, because that's what medicine always was, and it still is. So we shifted it actually to food is power, because that decision of what you put in your body is a powerful decision. And if a child is learning that early on, that I get to make this decision about what I put in my body, that can change the entire trajectory of their life. So that class is super fun, but we don't have a teaching kitchen. And usually I just pull all their school desks together. We bring a hot plate in, and I bring some stuff from my own kitchen at home, and we just get to it. And this is a recipe that we've made. This is just a simple scrambled egg dish. So I'm going to make it here for you. Zahra, would you mind coming up here? This is my daughter who came to assist. I don't know if I need you, but I'll just feel better if you're standing here, to be honest. So I'm just going to crack some eggs in here. Actually, if you wouldn't mind cracking these other two, okay? And then whisking them up, that would be a huge help. And then, no worries. So the goal with teaching a class like Food is Power, teaching culinary medicine, again, is not to create the sensibility that we all need to be chefs or that we all need to be nutritionists. Thankfully, we have wonderfully trained chefs around us. We have wonderfully trained nutritionists around us. Our job as healthcare providers, you can start whisking it up, is to remind people, again, that food is medicine and that this is something that they can do easily and quickly. So when I give recipes to patients, they're usually very, very simple, and they're things that they already make, but maybe with one small, slight tweak that isn't going to radically change the way that they're already living. As you guys know, behavioral change is a huge part of the work that we do, and we're not well trained in it. I really wish I had more time with a behavioral psychologist in medical school and residency who could have said, these are the effective ways that you get people to make changes in their life. But learning the hard way, I've seen that, saying, hey, we're going to move you from the SAD diet to the anti-inflammatory diet means they're not going to come back and see me ever again, because they're like, you don't get me. I can't even, I'm waking up late for work. I'm like running all day long. I'm lucky if I get one meal in. I can't do this. So seeing where somebody's at, meeting them where they're at, saying, what do you eat for breakfast? Okay, what's one thing we can do to change that breakfast you're already eating and make it a little bit better is far more likely to be successful and get them back in my office again for more work. So thank you so much. So it's just 4 eggs in here. We're going to add a little bit of sea salt and some turmeric. And the turmeric is something that is so near and dear to my heart. You're all familiar with turmeric now, right? This is so trendy, which I love. I love that it's trendy, because if you're Indian, it's like not trendy. Am I right? Like, this is just like what we had to eat all the time because our moms were just, giving us literally spoonfuls of it from when we were born. And there's good reason for it, of course, because turmeric is an incredibly potent anti-inflammatory, and there are actually gut receptors. It's particularly anti-inflammatory in the gut because we have receptors in the gut for the curcumin molecule, which is the active ingredient of turmeric, that respond very well. So I use turmeric in the whole form as a root, which, have you seen the root of turmeric? It looks like ginger, except when you peel it, it's like bright orange. It will stain the heck out of everything that you have, your fingers, your white aprons, all of your cooking equipment, and that's how you know you have a healthy kitchen. Everything will be stained with the color of golden turmeric. But I think it's something that really we need to be reminding people can be used more often in more dishes instead of just giving them supplementation. Okay, I know a lot of my patients are taking turmeric supplements, and I'm happy that they are, and I'm often prescribing those as well. But I'd love to see the whole turmeric being absorbed through the gut so that the gut has the opportunity to do the work that it does that is very different than when you take it in the supplement form. And also the bioavailability is very different, right? So turmeric typically, if we do it Indian style, we warm up the oil. Do we have some oil here? Sana, can you just check in the kitchen and see if there's some olive oil? Oh no, here, she has it measured out, sorry. So we have a little bit of olive oil. You don't need very much. And typically in India, what we'll do is actually put the turmeric and the black pepper together into the fat. So that emulsion happens. Again, this is ancient science, right? This is the way that it's always been done in India, that the way that the cooking preparations have been done, when you look into the science, make complete sense. You can't absorb turmeric without, I'm gonna mess up this white spatula. Is that okay? All right. Let me turn this way down. We bring the black pepper and the turmeric and the oil together, and in any good turmeric supplement, after much laboratory research, they have put the piperine and the biopterine, which is black pepper, into the turmeric supplement with a fat emulsion so that it's best absorbed. And that's basically what I just made here. It's just a little emulsion. Now the recipe says you can just put all of what I just did into the eggs, and you can do that as well, okay? But since this is the way my mom does it, I'm doing it the way my mom taught me. I do think there is a little bit of a benefit in getting that turmeric into the oil warmed up with the black pepper, again, to help improve the absorption. So just like you would regularly make your scrambled eggs, just pushing it around until we've got them into curds. So a little salt, little pepper, little turmeric, little olive oil. Already really healthy just as is. It's starting to look really shiny and beautiful. And this is so fun to do with kids because, first of all, I think all kids naturally love to cook and don't get nearly as many opportunities to. But it's just fun to hear all their reactions. They're always like, oh, this smells funny, or like, it's turning golden, and they're just enjoying the sort of scientific experiment aspect of it. But you'll see that these eggs just have this beautiful golden color now from just that little bit of turmeric, nice and warm. And then, how do you make these just a little bit more healthy? Just add some greens. So what it looks like what I've got here is some curly kale. Now in my garden, the curly kale has the real nice, like, beautiful curly crenellated border. In my garden, I like to grow the lacinato kale. Which is a darker green, non-curly flat leaf. And I just find that the flavor is a little deeper and it is easier to absorb and break down in the body than curly kale. So these are some nice things to learn about too. Like a lot of my patients have digestive problems, okay, a lot. And I can't just say a raw kale salad is a great idea for you. They can't digest it. They're going to feel awful, especially if they have irritable bowel syndrome or any symptoms that are irritable bowel related, which is a descriptor. Again, I think we depend very heavily on that diagnosis, irritable bowel syndrome. It is a descriptor, it is not a diagnosis. We have to dive deeper and figure out what is going on to create those irritable symptoms. But for that patient, this is not going to be something they're going to be able to eat just like this. So I'll say, hey, make sure you go for the lacinato versus a dinosaur or a curly kale, because that's going to be a little easier for you to digest. And then don't eat it raw. One way that you could do it is just take some of your greens and add them to your eggs in the morning and saute them down a little bit. I think there's just a lot of attention paid to eating things raw, greens raw. And I'll tell you, in many cultures, raw food is not consumed. Especially raw vegetables are not consumed. And more I'm seeing in my patients that very few of them can tolerate it as they get older. Again, I'm seeing sick patients, so it's a little bit different, but a light saute is not going to change the nutritional content of your food. Boiling it down into mush will, but a light saute is not going to change that nutritional content. And in fact, it can improve nutritional content if it's better absorbed than it would be otherwise, right? And it's not being excreted whole. So just kind of adding this in here, waiting, and the green turns into like this really, really beautiful green, this sort of fluorescent green, and that's when it's ready to be done. And I usually chop mine a little bit finer. I so appreciate having everything pre-prepped. I feel like a total, TV show chef right now. But I'll chop my greens really finely and remind patients to do this as well, because again, if this is something new for a patient, those very tiny little, almost herb-like slivers will just be a lot easier to digest, add a little pop of color, not feel like it's just this oppressive big change. Yes?
So another question about the turmeric. When I purchased the food, I felt like I was almost trying to prepare it, to peel it, to grate it in my grater with big holes. What is your process for peeling and grating?
That's a great question. I had learned a trick from a friend who's a chef on peeling ginger and turmeric that has served me so well. Voila! Feel free to come and have a little bite of that. So, Dr. Geeta, super simple breakfast, or lunch or dinner. This doesn't have to just be breakfast. Turmeric. So ginger and turmeric, to get that hard outer coating off, a spoon, not a knife. It is just so unwieldy and difficult with a knife, and you end up chopping half the ginger and turmeric off and throwing it away with the skin. Just using, let's see, do I have a spoon up here? I'll just use this measuring spoon. Just pretending this is a regular spoon, just using the side of the spoon. That'll just get just this thin layer of skin right off and expose the entire root. And then I like to, one of my favorite tools in the kitchen is a microplane. Do you have one of those? It's like a big zester, and I use that for turmeric. So that's, and of course it stains it, but it's really nice for turmeric. And it's just such a fibrous root. It's hard to chop it into small enough pieces for it to not overwhelm the dish, because it is a very strong flavor. So again, when you're mixing it with some eggs and pepper and some other greens, it lends itself very nicely. But I have patients who are like, oh, I put 4 tablespoons of turmeric in my smoothie, and I'm like, whoa, it's healthy, but that's not going to serve you, actually. That's a real irritant to the digestive lining, to the intestinal lining, to take that much turmeric in at once. And in India, when we make, a lot of our food has turmeric in it. In fact, all of the study that came around turmeric, all of the sort of fervor, really grew around some brain health studies when we were looking at population studies around dementia and seeing which countries had the lowest rates of dementia, and India was one of them. And then from that, sort of focus, this sort of distilling down into the nutritional studies revealed that turmeric could be a big part of that. But we don't eat it in massive quantities at once. It's just in small amounts in curries and other cooked foods throughout the day. Yes?
Freeze it before you grate it.
Freeze it before you grate it. Okay. Great tip.
20 minutes in the freezer.
Okay. Great, thank you. That's a great tip.
Do you do more powdered or do you do more fresh turmeric?
I do both.
Do you both?
I do both, yeah. I'd say probably more powdered than fresh, just out of convenience. Yeah.
So your eggs can be done with powdered or fresh?
Yes, exactly. And like I said, they can be, a lot of recipes will say just put everything into one bowl, mix it together and put it into the pan. And I haven't seen a study that shows whether you do this versus whether you do what I did, but in India we typically create something called a tadka, which is putting all of our spices into oil and warming it up first, and then adding our onions and our garlic and the rest of our dish. And I can only believe that there was a strong medicinal reason for doing that, so I followed that. All right, I think this feels like I filled up the space. I'm very grateful for your attention and for this time.